Hi, Assalamualaikum. I am Fatiha. In this presentation, I will share about ADHD and learning disabilities. So, let's get started. First of all, I will start with the definition of ADHD. So, ADHD or Attention Deficit Hyperactivity Disorder is a neurodevelopmental disorder defined by impairing levels of inattention, disorganization, hyperactivity, and impulsivity. ADHD is one of the common psychiatric disorders in childhood, but sometimes can prolong until adulthood and is more frequent in males than in females in the general population. The diagnostic criteria for ADHD can be categorized into two components. The first component is inattention, in which individuals with ADHD often fails to give close attention to details, where they can make careless mistakes either in schoolwork, at work, or other activities. Next, they often have difficulty sustaining attention either in task or play activities, for example during lectures, conversation, or even lengthy reading. They also often does not seem to listen when spoke into directly, in which their mind always elsewhere even when there are no any obvious distraction. Next, they often does not follow through on instruction. For example, like schoolwork, they do it halfway and easily get sidetracked. Moreover, they often has difficulty organizing tasks and activities. For example, struggle to keep belonging in order, disorganized work, and has poor time management. Next, they often avoids, dislike, or is reluctant to engage in tasks that require them to sustain mental effort. For example, like schoolwork, or for older adolescent adult, like completing survey or reports. Next, they often loses things necessary for tasks or activities. For example, school material like pencil or books. For adult, like car keys or wallet. Is often easily distracted by extraneous stimuli in which they usually get unrelated thoughts. And lastly, is often forgetful in daily activities like doing chores or paying bills. The second component is hyperactivity and impulsivity, where they often fidgets with tapped hands or feet or squirms in seat. Next, they often leave seat in situation when remaining seated is expected, often runs about or climbs in situation where it is inappropriate, often unable to play or engage in leisure activities quietly, is often on the go, acting as if driven by a motor, often talks excessively, often blurts out and answers before a question has been completed, often has difficulty waiting his or her turn, and lastly, often interrupts or intrudes on others. So, with six or more of the following symptoms for each component can cause impairment in their activity daily living. There are theories that hypothesize to be related to ADHD. So, there's this popular literature suggested that ADHD is related to food additive and the amount of sugar in child's diet. However, the National Institute of Health conclude that there is no evidence that diet is responsible for the onset of ADHD. Next one is the neuroanatomy theories, where in the study of neural imaging, there is a significant decrease in brain activity in the frontal parietal lobes, which inhibit impulsiveness and control attention that has been demonstrated in adults with ADHD. However, the primary cause of this decreased activity is still unknown. Next, for genes or heritability theory, Studies reported that it is clear that ADHD runs in family, where siblings of children diagnosed with ADHD are 5 to 7 times more likely to be diagnosed with ADHD. Lastly, the response inhibition theory. Researchers suggested that the symptoms seen in ADHD are a result of response inhibition, which prevent accurate self-regulation to the environmental stimuli. There are two primary medical intervention strategies, include pharmacotherapy and behavioral interventions. So, pharmacotherapy allows 9 out of 10 affected children to focus and excel at school, home, and play. The example of stimulant pharmacotherapy is amphetamines and methylphenidate. Pharmacology treatment seems to improve overactivity, attention span, impulsivity and self-control, compliance, physical and oral aggression, social interaction with peers, and academic productivity and accuracy. However, there are some side effects of this drug, include weight loss, loss of appetite, interrupted sleep patterns, and in some children, slowed growth. Next is the behavioral intervention. The most frequently recommended therapies are cognitive behavior therapy, behavior modification, educational interventions, social skill training, and psychotherapy. School-based occupational therapies provide a variety of strategies to the classroom to improve attention and focus. Examples include modifying the classroom environment, social skills training, self-management technique, and intervention to enhance sensory modulation. Now, I will continue with learning disabilities. So, learning disability refers to a heterogeneous group of disorders manifested by significant difficulties in the acquisition and use of listening, speaking, reading, writing, reasoning, or mathematical abilities. There are 9 categories of learning disabilities: disorders of motor function, educational disorders, disorders of attention and concentration, disorders of thinking and memory, problems with speech and communication, auditory difficulties, sensory integrative and perceptual disorders, psychosocial problems, and lastly, specific learning difficulties that accompany the learning disability. So I will explain in detail of this category in the next slide. So the first one, disorders of motor function, include disorders of motor skills and motor activity level range from clumsiness, poor performance in gross or fine motor skills, problems planning new tasks or dyspraxia, equilibrium deficits, and sensory motor problems in a number of areas. The next one, educational disorder, is limited or delayed educational skills such as copying from the blackboard, cursive writing, organizing time and materials, understanding written and oral directions, symbolic confusion or reversing letters, cutting, coloring, drawing, and spacing. And next one, disorders of attention and concentration are like short attention span and other attention deficit, restlessness, impulsivity, and motor and verbal preservation. Next, disorders of thinking and memory. These type of disorders are characterized by two components. The first one is difficulty with abstract reasoning and concept formation. The second one is poor short and long-term memory capabilities. So for problems with speech and communication, they display difficulty in speech and communication, such as shifting topics of conversation, small talk, sequencing of words, sentences or sound, slurred words, and articulation problems. The next one, auditory difficulties, is problem with auditory perceptual and memory, such as auditory memory, phonemic synthesis, speech in noise, and lastly, next, sensory integrative and perceptual disorders. Children with learning disabilities often have various sensory integrative and perceptual disorders, such as difficulty with laterality and directionality concepts and tasks that require visual perception skills. Next one, psychosocial problems. They are sensitive and decidedly at risk for poor self-esteem and for self-concept problems. They have the intelligence to know when they are being teased, understand the frustration of being good at some things and not at others. And lastly, for specific learning difficulties that accompany the learning disability, this is most frequently a specific reading disability. The interventions for young children include sensory integration, play, and basic socialization, as well as self-help skills. For school children, is sensory integration intervention, additional programs to promote social play, perceptual motor integration, and writing skills. For early adolescent, is independent living skill, social skills, development of compensatory and adaptive techniques, and lastly, vocational skills and interests. So, that is all from me. Thank you.